My name is Pamela Jarrell, and I'm a nurse at Levine Cancer Institute, and I work in the non-malignant hematology space along with Lawrence, but we work with two different populations. The program I work with is called the Hemophilia Treatment Center. So like sickle cell, the diseases that we work with are inherited. The difference is with our patient population, the majority of them are missing a protein in their blood so that they do not clot the way they should. So if they get a cut, they bleed much longer than you would if you were to get a cut. I am not originally from Charlotte, but I've lived here for almost 30 years. So I feel as much like a native Charlottean as most people. I grew up in the mountains of North Carolina, went to school at UNC Greensboro for my first career, and then went to nursing school in 2007. So I'm thrilled to be here with you tonight. So I thank you for the invitation, and I am thrilled that you are here tonight. So we're going to talk in this session about complementary therapies for stress relief and management.
Pam, quick question.
Yes.
How would you like to set the tone for your question Q&A part?
Yeah, I was just going to try to advance my screen. There we go. Let me just do this disclaimer. This presentation is intended for educational purposes only, and it does not replace medical or professional advice. So please speak with your physician before starting any program or routine. So again, here's me, and you are more than welcome to put your questions in the question and answer during the presentation, and I can address those as we go. Or if you would prefer to hold your questions to the end, that is fine as well. I am completely flexible and I do not mind interruptions. So if you want to even raise your hand to ask a question, I think Lawrence is going to be monitoring that. So feel free to do so. All right. So our topics for tonight are mindfulness. We'll talk about acupuncture and dry needling, and then we'll also talk about movement and creativity. So when we talk about complementary therapies, what is it that we really mean? So a complementary therapy is a therapy that is used together with conventional medicine. So conventional medicine would be things like healthy eating, exercise, medications, red blood cell exchanges, and the like. And complementary therapies are things such as mindfulness, massage, acupuncture, movement, and creativity, and lots of other things. So when you combine the conventional therapies with the complementary therapies, we're really talking about therapy for not only the body, but also the mind and the spirit. So as a nurse, I fully support conventional therapies, obviously, or I wouldn't be in this field. But as a nurse and also as a patient with chronic pain, I also believe very strongly in complementary therapies. And we will get into the weeds of that. But when you combine those into what we call integrative medicine, which combines the conventional and the complementary therapies, it really does give a broader range of benefits than just focusing on one or the other. All right, so the big question is there really a connection between your mind and your body? So let's consider a few questions. Can your thoughts change the way your body feels physically? Can the feelings in your body change your thoughts? Can your emotions change how your body feels physically? And can the feelings in your body change your emotions? So that's a lot to think about, a lot of questions. So let's do a little exercise. All right. Everybody get in a comfortable position, whether you're sitting in the chair, lying on the couch, laying in the bed, wherever it is, just get comfy. And I want you to close your eyes, okay? I want you to relax your shoulders, relax your face, relax your arms. Just get really, really relaxed. Keep your eyes closed and just listen. All right, so imagine that you are sitting at your kitchen table. You have a lemon sitting on the table in front of you. Now imagine that you pick up that lemon. Imagine yourself cutting that lemon in half. Pick up half of that lemon and smell it. And then I want you to bite into that lemon. Okay, everybody can open your eyes. So this is a part where you can come off your mic and be interactive. But was there anything that you noticed during that exercise? When you picked up, imagine that you were picking up that lemon. What did you think? What did you feel? Was it cold? Was it warm? Did it feel bumpy? Did it feel smooth? Was there a label on the outside of it? Now, what did you imagine when you were smelling that lemon? Did anything happen in your nose? Could you imagine the smell? Did anything happen in your mouth? Did you notice any extra saliva when you were smelling that lemon? So then the big question is, when you bit into that lemon or imagined yourself biting into that lemon, how did you feel? Did your body have a reaction? Did you say, this is the most delicious thing I've ever tasted? Or did you go, oh, this is really sour? And did you feel tingling in your jaws? So that is what we mean when we talk about the mind and body connection, because you didn't really have a lemon in your hand, but imagining the texture, imagining the smell, imagining the taste gave you physical reactions. And that's that mind and body connection. Okay, does that make sense to everyone? Does anybody have a question about that? All right, that kind of sets the tone for where we want to be. Let's talk just a minute about thoughts versus feelings. And this can be really hard to do sometimes, differentiating between what's a thought and what's a feeling. So your thoughts are often opinions or assumptions. And the feelings are often a product of the way you're thinking about something. And those feelings can be emotions, or those feelings can be body sensations. So, example, have you ever done something or said something and all of a sudden you say, I feel so stupid? I've had it happen to me. I'm sure we've all had it happen to us. But when you break that down, the thought process is perhaps, I am stupid. But the feelings in that moment could be shame, sadness, hurt, embarrassment, or a number of multiple emotions. So just a sentence of, I feel so stupid. There are thoughts in there and there are feelings, and it's important to try to separate those two. All right, so chronic pain. Now, I know that pain is not a new topic for you because I know that you deal with it every day. So we'll move through this section really quickly, but I want to show you this just to show that without any kind of intervention, chronic pain is a loop, and it's called a positive feedback loop because you start with pain, your body has a physical reaction, your brain has a reaction, your nervous system has a reaction, the pain increases, the body has more of a reaction, the nervous system has more of a reaction, and we end up right back where we started with pain. So if we never have an intervention or multiple interventions to break that feedback loop, we never get out of pain. With chronic pain, as you know, your body learns to detect that pain. But again, without interventions, even the slightest pain can cause your body to have a full response. So slamming your finger in a car door versus bumping your elbow on the edge of the desk can cause your body to have a full response unless there are some interventions. So when we focus on the power of our mind and body, and we use complementary and conventional therapies, we can learn how to relax our mind and ease our body of pain. And it helps us take away that body's overactive response to pain. So again, complementary therapies can help break that positive feedback loop. So the first area I want to focus on is called mindfulness. Now, the dictionary defines mindfulness as the practice of maintaining a non-judgmental or heightened or complete awareness of one's thoughts, emotions, or experiences on a moment-to-moment basis. And boy, that sounds like a big task. But the part of that I like the most is just the simple 4 words. It is a state of awareness. Now, mindfulness is not a new concept. Some of you may have heard the term everything old is new again, because you may have heard, or someone may have told you at some point, mind your manners, mind your P's and Q's, mind your language. So mindfulness simply means being very intentional about your thinking. And it means learning how to act in a positive manner versus reacting, which may not be the most positive manner. All right, let's talk about eating and mindful eating. Let's be honest. I'm going to be really honest with you too. Have you ever sat down with your favorite snack food? Say you sat down with a bag of Doritos, you're watching a movie, and at the end of the movie, you look down and you go, wow, I just ate that whole bag. Well, that is called mindless eating. So that is not what we're talking about. What we're talking about is being mindful about your eating. It's just being fully attentive to the food that you buy, that you prepare, that you serve and consume. So a few things to think about. Make a shopping list before you go to the grocery store. So over on the right-hand side of the screen, you'll see a shopping list. So I started out with a shopping list of cookies, apples, potato chips, soda, and water. I set that grocery list aside and I went back to it and I said, cookies. Do I really need cookies? No, I'm going to get some dried fruit instead. Apples. Yeah, I'll keep the apples. That's good. Potato chips. Nope. You know what? If I buy those potato chips, I'm just going to eat every one of them. So I'm going to buy some nuts instead. Soda. Do I need that sugar? Probably not. Do I need all that artificial flavor, artificial color? Probably not. So I'll get some water. But I may not just get plain water. I might get some flavored water, but that's good for hydration. And I know you guys know about hydration. And I have oatmeal on my list, and I think I'll keep that. So after making my list and going back and reconsidering, I can make some better choices. But if I just do it at a snap and don't ever think about it, then I'll end up buying a lot of things that I shouldn't. Another thing is to never go to the grocery store when you are hungry. Because when you go to the grocery store and you're hungry, you will buy a lot of stuff that you don't really need. Another thing about mindful eating is the portions that we eat here in America are huge. So start with a small portion. If you go to a restaurant and you order a hamburger, cut the hamburger in half. Push one half to the side, eat the half hamburger, and see how you feel if you still feel hungry. But while you're doing that, appreciate the color of your food, the texture, the temperature, the flavor, and take small bites and chew thoroughly. Also, slow down and eat without distraction. Now that goes back to the movie where you're focused on the movie and you're not focusing on the fact that you've eaten the whole bag of Doritos. And then identifying hunger versus wanting to eat. And this is a hard one because here in the South, everything we do focuses on food. So you may want to eat, but you may not be really hungry. But it is important to pay attention to those cues and keeping a food diary, writing down every day what you eat and then going back and evaluating that and see where you made not so great choices and think about new choices that you might make next time. So there are some amazing benefits to mindful eating. The most obvious one being weight loss and weight control. And my patients, and I know you as well, have pain in your joints. So there is some research out there that with every 1 pound of weight loss, there is a 4-pound reduction in the knee joint every time you take a step. So losing 1 pound takes 4 pounds of pressure off of your knee joints. And that would also take pressure off of your ankles and your hips, which I know are also important areas in sickle cell. Being mindful about what you're eating can reduce binge eating. And then really understanding how foods make you feel, both emotionally and physically. So the QR code on the screen will take you to a list of apps for mindful eating. So I will give you just a second if you want to snap that with your camera. And if you miss it or you lose it, I will make sure that Lawrence has a full list of all the QR codes so that they can be sent out to those of you who are on the call. All right. Let's talk about meditation. This is an area that I think a lot of people misunderstand. Meditation is simply a time to be quiet and relax and allow your mind to refocus and perhaps redirect some of your thinking. Some features of meditation: it's blocking out all the distraction, blocking out all the noise, and just being present in a quiet moment with some relaxed breathing, being in a comfortable position, and having an open attitude. Opening of your mind, opening of your spirit. Now, you don't have to go to a special place. You don't have to wear special clothes. You don't have to sit in a special position. You can do meditation anywhere, anytime. When you're sitting and watching TV, every commercial break, do a little deep breathing. Deep breaths in, deep breaths out. I'm a very fast walker, so sometimes I make myself just slow down my walking. And it's amazing how much less stress I feel when I slow down. You can pray, you can read, you can reflect. But that's all part of meditation, is just being in a quiet, noise-free, stress-free, distraction-free zone that can give your brain time to process all of your thoughts and all of your feelings. So benefits of meditation, high blood pressure. Meditation can actually help reduce your blood pressure. Now, the first time I heard that, I thought, that sounds crazy. And that sounds like something one of my favorite doctors would say, that that just sounds like something that separates people from their money. I know you've probably seen some of the devices on TV, the things that go around you that measure your breathing. But what happens when you are in a relaxed state, your blood vessels are less stressed. Now, when your blood vessels are stressed, they constrict. So when they're relaxed, they widen. And as that relaxation process takes place in your veins, in your blood vessels, there is a molecule that is released called nitric oxide. And nitric oxide helps keep your blood vessels relaxed and widened. So it helps reduce your blood pressure. So just something to think about and try. Meditation, especially at night, can help you sleep better, and it can reduce muscle tension that can lead to headaches and muscle aches. Meditation also allows a time for self-awareness. It gives you time to process negative thoughts. So if I am thinking, I have had the worst day ever, and I go home and all I think about is all the bad things that happened during my day. But if I sit down and give myself time to think about it, then I can reduce the negative thoughts and find some positives. It can also give you time to be very creative and very imaginative. It's amazing what can come to your brain when you give it time to relax. And it also increases your patience and your tolerance, because we all know the more stressed we are, the less patience we have with other people and with ourselves. So if we're relaxed and do a little meditation, we can increase our patience and tolerance. So again, there's a QR code here that will take you to a list of apps about meditation. And some of them are actually programs that you can play and listen to, and it will take you through the steps of meditation. And there's also a video link in that QR code. All right, so the next part of mindfulness I want to talk about is journaling. And I know when I was a kid, I kept a diary, and maybe you did too. The new term for keeping a diary today is called journaling. And really anyone can do this because, and at any age, because it's not necessarily about writing. Because number one, you're not writing for anyone else to read this. you are writing for yourself, and you are writing in a way to release some of what's inside of you. Doesn't have to be complete sentences, doesn't have to be perfect grammar. You just write about what you're feeling and what you're thinking, whether it be past, present, or future. And journaling is a great way to recognize patterns in our behavior and recognize patterns in the way we think about things or the way we have reacted to things. Now, I know the majority of you keep a pain diary, and that's terrific. But in addition to the pain diary of just writing down when you have pain and what time of day, but begin to think about the circumstances around that time when you're having pain. Is the house really busy? And is your pain less prominent when things are quiet and relaxed? So taking time to really look through that and analyze it and see if you see some patterns. Now, I am a doodler. I don't know if anybody else here is, but I am a doodler. And these are my doodles over to the side. These are real. These are out of my notebook that sits beside me at my desk. And when I was doing this presentation, I started looking at my doodles and I was like, you know, my doodles seem to have a pattern to them. I've got two circles with dots in the middle. I've got squiggly lines that look really, really messy here, and up here at the top, they don't look so messy. I've got arrows, lines, brackets, and I started thinking, why do I have patterns to my doodles? And what I realized is that the majority of the time when I'm doodling is when I am on hold on the phone. And usually I'm on hold with an insurance company, which is incredibly frustrating. So I've analyzed myself to say that my doodles are a way for me to make have a little bit of control over this situation that's completely out of control, because I can't do anything but sit there and wait for somebody to talk to me about what I need to talk about for a patient. So that's me. That's a self-disclosure. But there's lots of other benefits to journaling. It's just a healthy way to express yourself. If you're feeling really, really angry, maybe it's best to step away from that situation, grab your journal, and kind of just jot down what it is that you're feeling and what you're thinking, so that you can go back and look at that and analyze it and say, why did I get so angry? And could I react better the next time? So it's just a really good snapshot of what's happening in real time, and then being able to go back and look at that and see what patterns you see and what you may be able to do different the next time. So again, here is a QR code for you that will take you to a list of apps about journaling. So now I want to talk to you about acupuncture and dry needling. And this may be something that you're not terribly familiar with. So acupuncture and dry needling both involve the use of very small needles. Now, I don't know if you can see this, but this is an actual acupuncture needle. It is basically as thin as a hair. So hopefully you can see that. So we're using those needles in both acupuncture and dry needling. So, but they're two very different concepts. In acupuncture is rooted in traditional Chinese medicine. And on the picture, you can see there are lines and dots. So the concept behind acupuncture is that multiple needles are placed along what are called lines of qi, or lines of energy. And there are different lines of energy on the body for different conditions. For example, fever, and the picture that I show here is actually acupuncture lines of qi for fever. But it could be abdominal pain, back pain, any kind of pain. In acupuncture, there are lines of qi in the body that are believed to control that energy. So if you can follow those lines of qi and release energy, you can alleviate the problem. Now, in dry needling, it's a little bit different. It is a technique that physical therapists use, and it is one needle in one spot, which is called a trigger point. But the concept behind the two are somewhat the same. Whenever you insert even this teeny tiny needle into a muscle, it causes what's called a microtrauma. It's a very tiny injury. But with any type of energy, the body's healing response is kicked in. So all your good blood cells and all those other healing properties in your body come to the site of injury. And both can induce a sense of well-being, relaxation, and control. A word of caution about both acupuncture and dry needling is that both should be done by licensed professionals. There is a national certification for acupuncture, and North Carolina actually has an acupuncture licensing board. Now, physical therapists can do dry needling as part of their scope of practice. So if you are referred to physical therapy and they suggest dry needling, you would of course want to talk to your physician, but that is something that is within their scope of practice. Some benefits of acupuncture and dry needling are improved range of motion. And I have to tell you, my husband is the biggest skeptic when it comes to anything of this nature. But he had frozen shoulder syndrome, and his physical therapist said she wanted to do dry needling, and he said, okay. And now he's a believer because it helped him that much. So he could then freely move his shoulder, but it could be any joint of the body because you're helping release the tension in the muscle. And that in itself can help with pain reduction. So again, here is a QR code for you that takes you to a video about dry needling by a physical therapist to show you what that's all about. So let's talk about some movement therapies. And two that I really, my patients have found useful are yoga and Tai Chi. As we get older, we all worry about falls and broken bones. And even if you're young, you don't want to have falls or broken bones. So yoga and Tai Chi are two movement therapies that really promote your balance, which can help prevent falls. It can increase the range of motion in your arms and your legs, and it can give you an overall sense of well-being. The great thing about yoga and Tai Chi is they are both low to no impact exercises, which means you're not doing aerobics, you're not jumping, you're not climbing stairs, but you are using your muscles to lengthen and strengthen in both cases. So yoga and Tai Chi both promote relaxation, strengthening of your muscles, stretching your muscles can increase your flexibility, and I think one of the more important things is balance. You can start at any stage. You can start very gentle and progress your way to more advanced positions. And yoga and Tai Chi vary the routines, and there are tons of them on YouTube. Choosing different ones so that you're not working the same muscle group all the time. And if you happen to be in a yoga class or a Tai Chi class, talk to the instructor about poses that are too difficult for you, and they can give you adaptations to make it as beneficial for you as possible. There is some research out there on yoga that it improves physical, psychological, and social domains of life. And in patients with chronic pain, the research goes on to say that there was a reduction in the number of visits to the physicians for pain, because you're, again, lengthening, strengthening, and getting flexibility. So some benefits in both yoga and Tai Chi. There is an aspect of focused, deep breathing. When we take in more oxygen in our lungs, our brain is more alert. And again, things can be individualized. Even after years of a lot of joint damage, and I'll use one of my bleeding disorders patients as an example. In patients who have hemophilia, they can have bleeding into their joints, and it causes a tremendous amount of damage. So this gentleman, when he was younger, was very much into martial arts, and he did not really pay attention to his joints. And if he had a bleed joint, he said, whatever, I'll treat it. It'll be okay. But after years of that abuse, the heavy martial arts started to take a toll. So he stopped altogether. But then he found Tai Chi, which is more fluid movements, but it helped with his flexibility and it helped with his pain. And he actually wrote an article entitled, "How Tai Chi Saved Me." So it's a huge testament to some of these therapies that you go, oh, Tai Chi, really? I'm not going to do that. But maybe watch a YouTube video and do some real gentle movements and see how you feel. So, and I love this quote that says, the better we feel in our minds, the better we will treat our bodies, and vice versa. So just think about that. The better you feel in your mind, the better you're going to treat your body. And the better you treat your body, the better you're going to feel in your mind. So when you do a physical activity and you've done that successfully, it releases those feel-good hormones, those endorphins, and it makes you want to do it again. And that's what we call a great positive feedback loop. All right, creative therapies. Creative therapies are things like art and music. Now, I want you to think about this as not simply a distraction, but rather a way that you can teach yourself how to relax and maybe alter your mood. Now, to tell you, I am all about a good dance party. I can put on some music and I dance like no one is watching. I'm not saying my dancing is dancing with the stars level dancing, but it gets those feel-good hormones going, those endorphins going. So it's not only a way of release, but it's also pretty good exercise too. So active therapy, actually being involved, not just absorbing, but being involved with music, with art, or any other creative outlet can be a huge stress reliever and maybe take your mind off of the pain that you're feeling. So in summary, the benefits of complementary therapies, just helping us find something in our day to help reduce our stress. When we take a little bit of time out from a busy day, a stressful situation, a frustrating situation, we can start to feel a larger sense of self-control. It really can help manage anxiety and depression. It can help with your pain control and even with your perception of pain and improving your quality of life. And that's what we want for all of our patients, is to have an improved quality of life. Complementary therapies all have an aspect of anchoring yourself in the present moment, not letting your brain, your thoughts, and your feelings get ahead of you, but staying present in the moment. And then allowing us to release that negative energy during stressful moments in ways that don't impact other people. It helps us release that stored up negative energy, which can show itself in our body as muscle tension or as pain. So complementary therapies, using those as ways to be mindful about your day, mindful about your feelings, and mindful about your thoughts. So, as I said, in case you missed it, I will make sure that Lawrence has all of the QR codes to send out. And if you would like to reach me with any questions, this is our center email address, Hemophilia Treatment Center of lci.lch@atriumhealth.org. And with that, I thank you for your attention and your time, and I am glad to answer any questions that I can. If I don't know the answers, I will find out and get back to you.